The universal problems of Canada's universal healthcare system taking centre stage at the latest meeting of Canada's premiers in Victoria.
This isn't an isolated issue just for one province. It's pan-Canadian, and we need to come up with a solution that works for everybody.
It's going to need unprecedented levels of cooperation between provincial and territorial governments and with the federal government.
Healthcare leaders from across the country bringing a unified message to provincial leaders that the problems are the same wherever you go and the solutions are mostly the same too, and that the premiers need to go beyond the years-long rallying cry of needing more money from Ottawa, saying that's just part of the puzzle.
To really fix the crisis in healthcare, we need significant systems transformation, and that's going to mean a commitment to mapping out a short-term, a medium-term, and a long-term plan.
In the immediate, national licensing so healthcare providers can work province to province, then revamping primary care models. Longer term, centralizing referral and wait lists, overhauling hospital funding models to incentivize care, they say, not saving money as is the case now. The premier's ready to listen and make changes.
And I think it's time we listen to those people and got their information firsthand of how we can change.
They're ready to talk about what we could do to modernize this system. We need the federal government to tell us when we're going to have this conversation and give some hope to people that are on their last strings right now.
This moment of disruption caused by the pandemic creates an opportunity to look at the practice of medicine very differently.
But the focus being derailed, at least in part, by quibbling with the federal government.
This was the issue when I arrived, and it's the issue as I leave. And the federal government has refused to come and sit down with us and engage with us about what they believe the best way forward is.
The Prime Minister inflaming the situation, passing off the issue to his ministers, and more prominently in recent days, when he had met personally with premiers dozens of times over money and healthcare issues during the pandemic.
You know, where'd the love go? You know, I mean, everything was so fine, and then it wasn't. I mean, it's vexing that we could have made so much progress together.
So now doctors, nurses, and the patients they support left waiting to see what action will follow all this talk and if there will be changes that will actually improve care.
There's some transformative ideas that are larger that could really get us into a more modern system, but there are some quicker wins as well that we could be looking at that would start us down onto that track.
In Victoria, Liza Yuzda, City News.